So this is the last video in the series, and I want to say a heartfelt thank you to you for kind of following through this journey with me and listening to my story. I hope there are parts of it that you found useful, and parts of it you can use. I've made my way back here, so I'm actually back now, just walking down the hill where the bike came down when I went over the handlebars and landed on the pavement. This is where it all began 40 years ago, just on the corner of Greenholme Avenue, and I landed on the pavement just behind me right there and broke my nose at the age of just before I turned 5, just before my 5th birthday. I can still remember just coming down and landing on the road just about here, so this is exactly where it happened. The spot of tarmac here is where I broke my nose, and I almost got hit by a car when it happened. The chap driving the car picked me up and walked me down the pavement here back round to my house round the corner. So it has been a long journey, I guess, from that fateful day to today, when 5.5, almost 6 weeks later, after the operation, nose is looking straighter, but most importantly, I can breathe through my nostrils. I can breathe again. And thank you for joining me on this journey and listening to what I've got to say. There's been a lot that I've taken out of it, a lot of things I think that I've learned about kind of anxiety and anticipation about kind of medical and dental procedures, about that anticipation along the way beforehand, the preparation aspect of it, the support of friends and family being really important, and that's been something that I'm really grateful that I've had throughout this. Having to put your trust in the kind of medical team, and that's not just the actual surgeon and the person performing the operation, but it's the entire team, from the receptionist to the nurses and all the other people that are part of that journey, and the aftercare and advice that's given at that point as well. That's all just so important. But also just utilising some of these hypnosis style techniques when it comes to reduction of anxiety, to being able to manage pain and to promote healing, all those kind of things. And I think one of the interesting concepts is understanding that the part of you that is super anxious and super worried about what's going to happen with the procedure that you're having done, all that part of you wants to do is keep you safe, and keep you out of harm's way. And I think often it's almost like we're at loggerheads against that part of us, as if it's in some way wrong, or it's preventing us from moving forwards, when in actual fact all it's trying to do is keep you safe and stop you from being harmed, or stop you from having any trauma. And I think, I was explaining to somebody earlier on, for me, thinking back through the whole process, it's almost as if that there's two parts of you. There's the part of you that understands the benefits and the health benefits of going through the procedure, that understands that you're going to be okay, that understands that there are going to be difficulties and parts of it that aren't easy, but ultimately it's going to be worth it, and sees the end goal, that's able to see beyond the procedure and almost future tell and see this part of the process where everything's healed and everything's better. And then of course there's the part of you that is anxious, that's worried things will go wrong, that's worried about how you'll cope. But ultimately they've got the same goal, these two parts. They both want you to be okay, they both want you to be well, they both want you to be happy. And I think in my mind, without realising it, separating these two parts and almost seeing them like a big brother, little brother. The big brother being the part of you that has more confidence, that has that ability to reassure and know that things are going to be okay. It almost supports that part of you that has the doubts and that has the concerns and the worries about having the procedure done. It understands it, importantly. It knows why it's feeling that way, and it understands that it can be supported through it, and it shouldn't necessarily be fighting against it and saying that it's wrong. It just needs support. So yeah, huge learning experience, massive, and it has certainly given me a depth of insight into dental phobia management that you know, I found fascinating, as much as obviously it was, you know, my own journey, my own experience, and I had my own anxieties and things throughout that whole thing. You know, I've benefited from the surgical procedure, being able to breathe again, but massively from the psychology of understanding the process that people go through. I think it's been a massive learning experience, and also realizing that it doesn't really matter you know, how big a procedure it is that you're having, because it's all about perspective. You know, for me, this was a massive procedure, but for somebody who's having a far more invasive type of surgery, looking at what I had done might seem very, very easy. But none of that matters. So whether it's a scale and polish, whether it's a small filling, you know, whether it's septorhinoplasty, whether it's open heart surgery, it is kind of irrelevant. What's relevant is your own mindset, and how that experience impacts on you, and your coping abilities and your coping strategies. And it's all about having those coping strategies in place. So I'm now just walking around the corner back to the street where I used to live as a kid, which is where the man carried me after my accident, and I feel that yeah, that kind of aftercare that he gave that day and carried me around to my house, which is just up the road there, is similar to the process of what I've done for myself. I've carried myself, you know, from that day to today, where I can now breathe, and of course I've got an aesthetically straighter nose, which you know, is not a bad thing either. But I'm just looking forward to breathing and you know, being able to just get on with a normal life. I've still got a little bit of numbness at the tip of the nose here, and it's still quite tender. Still got to be very cautious when I wear the visors and masks and things like that. So I'm wearing a hood at work just now, rather than you know, having something firm clasped on it. And that's okay. And again, understanding the limitations after you've had anything like that done, and just being cautious, and, you know, taking care of yourself, carrying yourself, looking after yourself. So once again, thank you so much for joining me on this journey, and I'm going to leave it here, you know, walking away from the spot where it happened, because, you know, that's what we do in life. You have an experience. I came back to that spot to start this video because I thought that was a nice metaphor, just finishing where we began. But actually, I thought walking away from there is important as well, because you know, isn't that what life's all about? You have your experiences, and then you move forward. You move on to the next experiences and the next thing, and you know, life moves on, and you face your next challenges, your next adventures, and whatever comes next. So that's me. That's been 8 minutes, and I'm not quite sure what I've warbled on about, but I hope it made sense. And as you can see, I'm well, I'm happy, and life is good. So it's been a successful journey, and once again, thank you. So join me, you know, please do follow me on Facebook, Instagram. These videos are going to be on YouTube as well, so please do follow me, because there will be other videos, you know, not just about my own personal journey, but I'm going to share more strategies and techniques and things that can be used for dental anxiety, that can be used for coping skills generally in life. So these will all go up onto these channels as well. So please do follow me, and please do you know, please do keep watching, because there's going to be more things that are coming, that hopefully you'll find very useful as well. Okay, bye for now.